already in the room for joining us today and for being here this afternoon. I see there's still people who are arriving in the room, but I think in the interests of time and moving through the content that we need to share today, I'm going to kick us off to start now, and people can continue to join through the introduction. So I'm Sarah Goodyear, the Monitoring, Evaluation and Learning Officer for the Insight to Impact program. I'll start off with a few small housekeeping announcements, just as everyone continues to join and before we get properly underway. Firstly, please feel free to ask questions and share your learnings and comments as we go using the chat function. We'll pass these along to the speakers at the question time for their response and engagement. So please do make full use of that channel for the questions that you have. There'll also be a few polls that will pop up at various points during the webinar. So please do let us know your thoughts by answering these polls if you'd like to participate in them. We're looking forward to seeing what information you have to share with us. And now to get things properly underway, I'd like to introduce you to the facilitator for our session today, Hennie Bester. Hennie is the lead of the Insight to Impact program and a director at Cenfri. And he'll be leading us in the webinar today. So thank you very much, Hennie, and handing over to you.
Well, Sarah, thank you very much. And good afternoon, good morning, good evening to our participants, wherever you may be in the world. It's a pleasure to have you with us. Insight to Impact, or I2I for short, is a global resource center which really seeks to improve financial inclusion, financial usage through the smarter use of data. We were launched in 2015. We are jointly hosted by Finmark Trust and Cenfri, both of these based in South Africa, and we are funded by the Bill and Melinda Gates Foundation and the Mastercard Foundation. And as our program has been running for 5 years, we've learned an enormous amount. So we decided towards the end of last year that as we go in our sort of final 12 months, we want to share some of our programmatic learnings over the past 5 years with people like ourselves. So we launched Open I2I, which is an initiative of which our blog series is launched by the Next Billion platform. But it's really about sharing what we've discovered. And it's proven to be a wonderful journey. And we've invited other programs, other organizations to also share their learning. And this afternoon's or this morning's event, depending on where you are, is all about sharing one part of it, which has been about alternative ways to gather data. And these innovations and pivots have been a key to us as an organization. It was actually 5 years ago a key objective of the program. But little did we know that 5 years down the line, these methods would be tested and would have to prove their mettle in an environment that none of us could even imagine would come. And that's the current COVID-19 pandemic. So what we've discovered is that these methods do have very substantial implications for development programming, and that we live in a time where adaptive programming really is absolutely important and key, particularly now that it's impossible to engage with people, households, individuals on a face-to-face basis. And what you still need is that you need good information, particularly when big decisions have to be made in the public and the private sector, and you need those to be representative. So in this webinar, we will be sharing some of what we have learned, and we have also invited one of our partners to share. So we'll be looking firstly at the adaptation of research approaches that involve face-to-face work. Then we'll be looking at the COVID-19 livelihoods tracking survey, really using mobile phones and particularly SMSs to gather survey data as an alternative. And then also how in this time you can use transaction data. Not always easy to access, but as a way to provide almost real-time indicators of what's happening in your economy. As Sarah also pointed out, for housekeeping purposes, you will see at the bottom of your screen, there's a Q&A function. So please feel free to use that to pose questions. We will not have live questions in the sense of individuals articulating personally. We can actually just deal with more questions in the question function. So please ask your questions and they'll either be answered in writing or I will ask them to our team. And then we will address them at the end of each speaker. So what we're trying to do is we've got 3 blocks of presentation of about 10-15 minutes or a little bit over it. And then we will give you an opportunity to hear the responses to the questions. So first up will be Isabelle Carboni. Isabelle is at Insight to Impact. She leads our measurement work, and that's particularly been around the measurement of financial inclusion. And we've been using transactional data and demand-side surveys to draw out insights and indicators, particularly now that in the digital payment space, there's been quite a few policy interventions to make it easier for people to transfer funds digitally. We're learning as we go. We've learned quite a lot. Isabelle has many years of experience in the measurement space. She was the global head of monitoring and evaluation for World Vision before she joined us. And Isabelle, this afternoon, in South African time, is sitting in Cape Town. Isabelle, over to you.
Hi, Hennie, and thank you. Thank you, everybody. I hope you can see my screen. It's a pleasure to be part of this webinar today. And what I'd like to share with you is a very exciting innovation, something that we've never done before as part of Insight to Impact, which was to access data for analysis using a VPN system, so virtual access to that digital data, and to share with you some of the challenges and opportunities that presents. Insight to Impact has a relationship with RURA, which is the Rwandan Utilities Regulation Authority. And through 2019, we had a major data analytics project with RURA to look at all of the mobile money transactions since inception. So that's from January 2016 up to September 2019 when we were finalizing our analysis. And given how quickly Rwandans have digitized and using mobile money, there's a huge volume of digital data available. We're talking about huge data sets for the population, accessing mobile money to make payments and to save money. And I'll go through that ecosystem in a moment. But they wanted to know and understand that whole payments picture. How is behavior changing in that digital space, and to be able to use that data for policy making and for regulation. On the back of this project, which we presented to the policymakers in February, towards the end of February, and even as we were flying home through the airport via Kenya, we were already being tested for heat sensors, for COVID-19, and we were being asked if we had traveled to Asia. So it was already kicking off, and by the time we got back, RURA reached out to us and said, look, what can we do now? The government in Rwanda had just instituted 4 major policy changes. to go into lockdown in mid-March to see what could be done to increase the digitization of the population, move away from the use of cash, and to alleviate some of the costs borne by the population. So that included things like zero rating of fees on P2P transfers and on digital payments for merchants. So Rura approached us and said, look, what can we track around these policy changes? How can we understand if people are responding to these policy changes? We don't want to wait for 6 months to find this out. We want to know now. So they threw us a challenge, and we had some in-depth technical discussions about what could actually be done to address this. You may be aware that in Rwanda, data is not allowed to leave its national borders. Therefore, we had to figure out how could we address this challenge of doing the data analysis on these huge data sets virtually. So we discussed the option of going with VPN, which had never been done before, either for them or for us, and to see, could we do big data analytics on location by accessing that through VPN. They were able to get that signed off, and we were able to move forward. The challenge for us then was, how do we do this? We have to establish a secure environment via VPN with the team at Rura, and given they were all now working from home as well. So they were subject to the connectivity that they had at home. They were subject to their own internal VPNs to access their own systems at the office, to be able to access the data, which was stored on different databases within their internal system, and build a database that would pull in the data to measure the key indicators that they were looking at, which was really around things like what are the trends in value and volume of P2P transfers? What are the trends in value and volume of digital merchant payments? How are other online or digital payments that could be done, such as government services and electricity and water, that could be done via mobile phone? How were those changing? What's been the impact on cash in and cash outs with agents and so on? And to be able to rapidly analyze those changes, report them back as we could. And then the long-term vision, well, I say long-term vision, has to be done by the end of May, is to create a dashboard to visualize that data on a regular basis. Sorry, I'm just moving my poles out of my screen for a second there. All right. Okay. To give you a sense of the data that was available to us, and from the previous project that we did with Rura, this is the whole ecosystem of mobile money that's available in Rwanda. So you see the red arrows here are your debit transactions. So that's how people are spending or moving their money. And the blue arrows are the credit transactions. So they're the money flowing into mobile wallets. So you get this sense of the inflows and the outflows and what the magnitude of those are, both through agents for cash in, cash out, the in-person or remote merchant payments, the P2Ps, the batch transfers, and push and pull from banks to wallets and back again. This situation created a range of opportunities, but also some quite serious challenges that are not insurmountable, but are worth sharing for anyone else considering this type of virtual access to transactional data. As Hennie mentioned earlier, we've done a number of projects with transaction data with banks, with regulators, and a national switch. And it can be a very long process to get sign-off to access financial transaction data, given that in most countries it is quite sensitive, or it may be private sector data, there are some serious hurdles that need to be jumped over with legal offices, with bureaucracies, at different levels of sign-off. So it's not a given that you'll be able to access the data in the first place. However, the crisis also presented an opportunity for us, given that we had this relationship already with RURA. We were able to move forward without requiring higher levels of sign-off. The first question to ask when trying to access virtual data is, where is that data saved? Is it data that is based on the cloud? Many countries and organizations, private sector businesses will use this option, which makes access to that data easier if you are given a remote login or specific encrypted access. The second option is, if the data set is not a huge data set with many, many different variables, it is possible to send it. This was one way that we've certainly got samples of data before that could be shared simply through a CSV file or an Excel file that could be sent through secure access. We had a partnership with a bank in Mexico that was able to share with us their data via a sending option. The third one is VPN. This presents the highest levels of complexity because you first have to establish that virtual private network into their system and then be able to access the different databases they might have within their organization. And with most organizations, there will be firewalls to protect and encrypt the data and keep it separate so that if a hacker was to get into the system, they're not able to access the different data bases that are within the. Thus, that tunneling in via VPN isn't the end in itself. You then have to get multiple different access options to be able to pull in the data that you need into another database. Which brings me to the next point, which is what data you actually need to answer your questions. Your data may be available just on one single database, which is the simplest version. But for many of these types of analysis, you need access to multiple different databases. For example, we were looking at credit and loans. We were looking at the cash in, cash out data. We were looking at the multiple digital payment options that are available via mobile money, which required access to different sets of data, including KYC data as well, to understand the differential responses of the population to these policy changes by men and by women. We next want to be able to look at that by different geographic location and age range as well, based on their KYC data. You also need to know who owns that data. We were lucky with RURA that as the regulator, they require the MNOs to share all of the data on transactions and the KYC data with them as the regulator on an almost real-time basis. So multiple uploads during the day of that data set. So we are able to get that without requiring additional sign-off. There are other projects that we are building where data needs to come from different places. So that may be owned by different institutions again. So that adds another layer of complexity and sign off. But if the data is in one location or owned by one bank or one MNO, it does make that process smoother and increases the opportunity there. The third point is, can you ensure sufficient data privacy and security? This is a big issue in Rwanda, but for all countries and all companies. Firstly, for the individual, can you anonymize the data? And it's important that the institution or the business is able to anonymize that data before you get it. And that ensures that in that transit or once you've received the data, you are not held liable for any breaches that might occur where data could be linked back to a named individual. The second is a time limit on the VPN. So with RURA, we were given a particular time window within which the data needed to be accessed, the analysis needed to be done, and the dashboard needs to be set up, and then that VPN will be closed. It will be opened again periodically so that we can do new iterations of the dashboard, fix any issues and bugs, and so on. But leaving that VPN open on a long-term basis opens up many risks in terms of breaches of security or hacking, which we've seen some data showing that incidences of cyber security and fraud are on the increase at the moment, given there are many small people sitting at home with access to the internet and not enough to do, and everything's being done virtually. Even Zoom has had its challenges with that, but it's important to respect that privacy and to put a limit around how long that VPN will be left open. The third is really just to list out what those protocols for data access will be. How long will data be available for? Who will it be available to, and at what point? And what governance will you put in place to ensure that that data is protected? For example, with the RURA project, we have a governance meeting that is set up that met on a weekly basis at the beginning of the project and now has gone down to a monthly basis. And this helps us to address any technical issues or bottlenecks that have come up and really smooth through that process to ensure that any issues coming up are being addressed. Which brings me on to the challenges. So many of the challenges are in that internal process and bureaucracy. So having those key stakeholders in a governance committee that can be part of that will help to move things along much more smoothly. There are usually several different levels of sign-off within organizations. You may have to go through their legal offices as well as their executive. One experience we had of trying to access data virtually, in the end, everything else was signed off, but at the last minute, we were prevented from accessing the data due to some compliance issues that we were not told about earlier on in the process, and their compliance department wouldn't sign off in the end. So the second is the connectivity issues at both ends. Sorry, I had a moment of connectivity issue there. The connectivity at both ends can be a real challenge. This is, at our end, we may be able to have secure connectivity, but at the end of our partners in Rwanda, we had many issues with connectivity where you might be in the process of accessing something and then the connectivity goes down or the system is down. The other challenge with VPN is actually system overload, because the way the system works is to build a virtual machine to access the data, which is built into their overall system, which is not used to managing this level of load that's being accessed virtually. So these are some of the issues that can seriously slow down your process. The security challenges I mentioned earlier have to be an ongoing basis. We need to bear them in mind. And finally, it's the race against time. Things are evolving constantly under COVID-19, and we need to be able to share the latest data with policymakers and decision makers to make sure that as they need to adjust policies, as they need to make those decisions around what needs to continue. Do they need to continue this policy on a longer term basis? Do they need to adjust it in some way? Being able to share the latest data with them on an ongoing basis so that they can keep moving as the economic crisis as well as the health crisis continue. Just in conclusion, a few points to share. That VPN and other virtual access does provide a really exciting new opportunity in this COVID era, where we thought perhaps this project would grind to a halt or we wouldn't be able to access the transactional data anymore. It is a really exciting opportunity to do that for transactional analysis. As long as you can have the security, you can have the connectivity and a dedicated system for that, to be able to provide policymakers and regulators with the most up-to-date data through dashboarding or through more in-depth trend analysis to present to them so that they can respond to their population's needs on an ongoing basis. Thank you.
Thanks, Isabelle. Perhaps just, we currently don't have questions, but I think just verbally you can perhaps give an indication there's been some pretty spectacular changes as a result of the pandemic in the transactions, and perhaps you just want to give one or two incidences of what that looked like, which is, after all, is why we did all of this.
Yes, sure. It has been really quite unbelievable to see how the population has responded to those policy changes. We're talking about a more than doubling of the levels of P2P transactions, of digital merchant payments, and the seamlessness with which money is now flowing digitally from mobile wallets to bank accounts. For example, on average, in a week, we would see about 50% of money that was flowing into a mobile wallet was cashed out. What we're seeing now is that only 10% is being cashed out, and 90% of the value in digital wallets is being spent digitally in some way, be that to sending P2Ps or spending larger values with merchants through a digital transaction or other digital spending. So a really significant change in digital payments behavior, which is exactly what the policymakers wanted to see, but to be able to see that so quickly in response. We now have 5 full weeks of data available since the lockdown was instituted. So we have some solid data to see, and week on week we've seen that growth increasing. It will be fascinating to watch that continue over the 3-month period and to see what will happen post-lockdown and what behaviors will stick and what might change. But yes, some fascinating data coming out of Rwanda on that change in payments behavior, digital payments.
Great. Thanks, thanks, Isabelle. Well, I'm now going to introduce Shirley Jeoffreys. Shirley is a researcher with our Insight to Impact, our Data for Financial Inclusion team at Finmark Trust. And Shirley has always been passionate about a rather arcane field, which is, mobile device-based surveys, and particularly whether such surveys can deliver results that are nationally representative. She's been working on this for 2 years, have achieved major breakthroughs, and now suddenly that face-to-face surveys aren't possible. Shirley suddenly finds herself in a position where these surveys are producing the first nationally representative indicators of how the pandemic are affecting some countries on the African continent. Shirley, you're suddenly in the limelight. Over to you.
Thank you, Hennie. Yeah, so as Hennie mentioned, I've been working on kind of what we call sustainable data collection for actually quite some time now, a couple of years, and it just so happens that what we've learned and the things that we've been developing over the last few years have been really useful in this time of crisis in helping us to actually do things differently because they have to be done differently. So I'm going to start just by talking a bit about the kind of innovation that we developed, and then I'll talk more specifically about what we're doing in the COVID-19 tracker that we're currently running, using similar but not exactly the same as the new way of collecting data that we developed. So traditionally, development surveys have really focused on, especially demand-side surveys, obviously, have focused on being nationally rep, and that has needed to be conducted face-to-face because reaching people who are not connected to the internet or don't necessarily even have a mobile phone requires that you actually go out into the field and you find them. And in the developing world, I think there are still very many people who are not so easily accessible with technology. But of course, it's very expensive, and I was quite pleased to see in the polling results, there are a lot of people who mentioned they were looking for cheaper, faster ways to do surveys in COVID-19 and beyond. And I think this is very useful information for, I think it was 80% or so of the audience that said they were interested in that. So we kind of set off with exactly that in mind about 2 years ago, thinking about how can we actually reduce the cost of data collection? Because it's so expensive to collect this data, we don't have very much data. There's kind of an information gap in the developing world because we have to save up all of our questions to go onto one massive, very expensive survey that, if we're lucky, happens annually, but more likely actually happens every 3 years. And there's a kind of twofold effect of that. The one is that the surveys themselves are very expensive to operate and run. But the other issue with that is because we're throwing everything and the kitchen sink into the surveys, the quality of the data could potentially be not very good, particularly towards the end of the survey as respondents are getting quite tired. So we really wanted to think of how are there ways to collect less data but more frequently, so that we end up actually having more data in the end. And that requires it to be very affordable data collection. So we really started to think about, is there a way that we can use a mix of data collection methods or data collection modes to achieve this? So I mentioned earlier that not everyone has internet access, or not everyone even has a mobile phone. So we need to think about how do we reach those people, but we also take advantage of the cost saving that we can get from technology. And then it's really about thinking about, so we can do that, but what's the balance? What's the trade-off between cost and then actually getting a good representative sample that's accurate and precise? So those are the kind of questions we asked ourselves as we set off on the journey. And so we did a very large pilot. We did it in 8 countries, 4 in Africa and 4 in Asia. And the pilot test that we did involved 3 modes of data collection. Our primary source of data collection that we wanted to use was SMS surveys, as Hennie mentioned earlier. I'm quite passionate about these mobile surveys, and SMS is actually strangely my key passion. It's a very weird thing, but because SMS for me is great because it's really affordable, but there certainly are limitations that are quite important to note. And the key limitations with SMS are that you can't reach people who are not literate enough to actually read and respond to an SMS survey. And then, of course, we're missing those people that don't have a mobile phone at all. And then there's another limitation that some people call a limitation, but I actually think is a strength of the method, and that is that an SMS is only 160 characters. So your question has to be, question and all answers needs to be short enough to fit into 160 characters. And I think that's part of where my passion for SMS comes from, is I feel like it forces us to ask simple, straightforward, easy questions that people can answer with ease. So that was our kind of primary source that we wanted to look at. And then in addition to that, we also because we know that SMS has some limitations, we used a sample of interviewer-administered telephonic interviews. So that's when a call center agent phones people and asks them the questions over their mobile phone. And what's nice about the call center agents being able to phone is that you can reach people who are less literate. But of course, you still can't reach those people that don't have a mobile phone. So our final piece was that we included a small face-to-face sample, and the aim with that face-to-face sample was to ensure that we could reach those people that don't have mobile phones and have some representation of them in our data. So we went about doing this survey in our 8 markets, and we then knew there was another problem in addition to the fact that we are using a sort of mixed sample of different people and different modes that can represent different audiences. In addition to that, it is known that people answer things differently on different platforms. So if you ask somebody something in person versus if you ask them over the phone or in a self-complete, they might actually answer differently. So we had to take into account all of these issues as we mixed our methods. So to bring the data together, we used a complex statistical model that is called multi-level regression and post-stratification. I'm not going to go into all the detail of how it works. There's quite a good literature available on that, and if anyone is interested, they can kind of pop us a note and we can share the literature on how MRP actually works. But essentially what it does is it takes into account both the mode effects, so the different modes and how people answer, and it brings your sample together and it weights the sample to be representative, even though it's coming from different sources. So it sounds quite complex, but I'm going to just show you very quickly some of the results to show you how effective what we actually did was. So you'll currently see on your screen a set of bar charts. And the first bar there is in a sort of yellowy color, and I call that the sort of gold standard bar, so let's call it a gold bar. And that is a face-to-face survey that was conducted, and in this case we're looking at Uganda, but it's a financial inclusion survey that is conducted face-to-face, it's nationally representative, and we asked these particular indicators on that survey. Then the second bar, the kind of gray color, is using SMS on its own. So only SMS, how did the results to that compare to our gold standard benchmark? And I'm sure you're not surprised, but you can see there's a very big difference with people who are answering via SMS being much more likely to have mobile money or a registered bank account. Then the next bar, the kind of royal blue bar, is applying the multi-level regression and post-stratification modeling just to the SMS data, so not including any other modes, it's just SMS on its own. And then you can see that the MRP does have an impact, it does improve on the results, but it doesn't completely account for it. But the really exciting bars are the next two, where we included a small face-to-face sample, and you can see the first one is just 150 face-to-face surveys, and the SMS portion of the sample is 1,000 surveys. And then the second one is 300 face-to-face surveys and 1,000 SMS surveys. And what you can see there is that we get really, really good results. And even on the very small face-to-face sample of 150, we really are replicating that face-to-face benchmark really well. So that's kind of at a very high level the work that we've been doing over the past 2 years. And this, we actually were writing up the results on it in February and March, and then that write-up got sent completely sideways by COVID-19 and the need to collect data very, very quickly and really get to representative data about to understand what's happening on the ground in Africa as a reaction to COVID-19. So we could use a lot of what we'd learned from our previous work, but obviously there are certain things that we can't do. So first off, we obviously, because of social distancing, it's not responsible to be sending field workers out into the field. So using the face-to-face portion of the sample that we used in our mixed methodology isn't actually, it's not something we can do at this time. So we can't use face-to-face to account for the strong skews in our data. But then also, because the SMS survey does limit us to those people who only have a kind of higher literacy level, we decided we should go with telephonic interviews with the interviewer only, and then think about how we weight and model the data going forward based on what we know. So just to demonstrate why we think that it's okay to do this, and we can actually reach people at the bottom of the pyramid using the telephonic interviewing. Just looking at our data from our previous pilot at what's called the PPI index. So it's understanding people who are living below the poverty line in each market. This chart compares what we got face-to-face for people below the poverty line, and then what we were picking up using mobile phones, either SMS or CATI, that it says there is the telephonic interviews that are used. So you can see we actually do quite well. We are actually reaching with mobile technology people who are living below the poverty line. And then just to kind of zoom in a little bit on Kenya specifically, you can see we are reaching quite a good sample of women, even though we know that mobile phone ownership skews to men. We are reaching a good sample of rural people. And then the very important thing to notice is the low literacy bar there, where you can see CATI coming up much more highly than SMS. So this is really what drives our decision that using telephonic interviews makes more sense when we can't include a face-to-face sample to balance out that we are missing those people with lower literacy levels. So our approach to the tracker then became not one of necessarily a mixed methodology and using modeling, but rather thinking very carefully about how we actually structure our sample and how we reach those people who are underrepresented. So there's a couple of ways you could do a telephonic survey. And because we come from a development background where going with the probability sample feels like it's the right thing to do, the natural feel would be like, okay, let's do random digit dialing and we'll get a representation of the mobile universe. But that's actually, I would argue, not the right way to do it, because your problem that you have there is that you're representing only the mobile universe. So you will have a sample that skews to urban people, that skews to men, and probably people with a higher income. So what we've actually done is we're trying to use telephonic interviews to represent the full audience. And we know from what I've shown you in the previous two slides, we do reach people below the poverty line. We do reach people who are in rural areas. We do reach people who have lower literacy, but they are underrepresented in a mobile sample. So we do need to account for that. So what we've done is we've applied an 80-20 kind of principle, where 80% of our sample is initially collected using random digit dialing. But then the final 20% of our sample is collected using quota sampling, where we look for who's underrepresented by the random digit dial, and then we have a profiled database that we can use to specifically target those people who are underrepresented. So in South Africa, as an example, we've found that young men in rural areas are actually quite poorly represented in a random digit dial of telephonic interviews. So we've specifically tried to boost that with our final 20% of our sample. And then what we've done on our final sample is we've weighted the data to nationally representative sources. We're using the DHS survey and the FinScope surveys. We're doing QC with the one and the other. So we're using two sources, but we are comparing them to make sure that what we're getting out we're comfortable with. In our very first wave of data, we did not include a quota on education level. And what we found is that we did not get a good representation of people who are in the lowest level of education. So people who haven't finished primary schooling, we were under-reading them, and we were over-reading people with higher levels of education. And that was the case in all markets. So for our second wave of data, which will hopefully be released quite soon, we have added that as a quota variable, because it's that limitation in our initial sample did mean that our weights are working a little harder than we'd like them to for the tracker. So now very quickly, I'm actually going to take you to our online dashboard. It's just opening slowly on my computer and show you some of the outputs that we've got from the survey. So this is available at COVID-19 tracker.africa. So if you want to go and play and have a look later, please do. So this is just our landing page. And then currently we have data for Kenya, Nigeria, and South Africa. We are also collecting data for several other markets. We've got Rwanda will be launched quite soon, and then Uganda and Zambia and Ghana as well. So I'm just going to click on Kenya and just show you a few things on here. So the titles across here are the different kind of sections of information that we've collected data on. So depending on what your interest is, there's different things that you can go and look at, but there's also a summary. So the summary covers kind of key health understanding, so how people are understanding the virus, and then if there's people are changing their behavior based on it, whether their chronic care has had to change, if they can access medicine. Then we're looking at some financial information, things like do they have access to emergency funds, have they borrowed anything recently, and so on. And I'm not going to go into all the detail of everything here, but
Shirley, sorry to interrupt. I'm not sure about other people, but I cannot see anything that you're sharing. There may be a, so if any of the other panelists are seeing it, then I may be missing it.
Shirley, I think you just shared the presentation rather than your screen, so it wasn't showing the website.
Okay, I'm going to try and
reshare.
Thank you. Okay.
Good. I'm pleased. I wasn't the only blind one.
Can you guys see it?
There's great. Now we can see it. Thanks, Shirley. Off you go.
No, thank you. Thank you for stopping me, because that would have been falling a bit flat without anyone being able to see it. Okay, yeah. So just to go back to where I was, so we're currently looking at the Kenya data. And across the top here, you can see the different sections of information. And then as you scroll down, this is just a summary. There's some information on the different themes or thematic areas that we're looking at. And there's more detail on each of these if you click through. So the summary is not every indicator, it's just a few summarized indicators. And then you can also filter the data if you're interested in anything specific. So you may be interested in women, and then you can just apply that filter and you can look at the data based on women specifically. So there's quite a lot of data and information there. And then we also have a resources page where we have more information about kind of some of these things are blogs that we've written about the data, and some of them are more technical. And then the data itself is actually also available for download. So you can actually download the data in CSV or SPSS if you want to. And also if you want to follow and know more about the study, please subscribe to our list. We are sending emails out as updates go up on the website. So that's really, in a nutshell, my presentation.
So Shirley, what I was going to suggest that there's some interesting questions. If you could get your screen into one of those interesting graphs that people can follow, then I could quickly pose some of these questions to you. you could do a financials or a food security one, for example, whichever it is there. And then people can quickly have a look at it. Great, I think this is fun. Now let me ask you some of the questions. So one of the first questions was, how do you ensure that your target respondent is the person responding to the SMS survey and not a different person?
It's an interesting question, and I've actually gotten this question a few times in the past, and it's the same way as you would ensure that your target respondent that an interviewer spoke to. So you can do quality control. So you can do telephonic callbacks to the person and ask them some QC questions. So you can do all of those things. In the work that we've done, we actually haven't done that. What we've done is compare them to previous answers that same respondent has given on other surveys, because we've used panel surveys. So we've done that to do some quality control. And then we also do things like we look for flatlining responses. So if somebody just seems to be answering the same answer to every question, then we would probably remove that person from the data. So in some ways, it's actually not that different from how you do quality control in face-to-face research. The only downside with it is it does add to your costs. So if you're looking to do something very quick, cheap, and affordable, adding a lot of QC does drive your cost up. So that's just the one thing to be aware of.
Great. Shirley, a related question from Guidi Rasconi is, how do you go about obtaining phone numbers?
So we work with a partner that has a developed database. So you've got two options. If you're doing random digit dialing, you wouldn't actually be retaining the phone numbers per se, because you're actually trying to get a fresh random sample of people. So you create the numbers randomly. And the way that you do that is you do the research into what is actually a valid number in each market. So in South Africa, sorry, I'll use South Africa because I'm South African. So as my example, in South Africa, you would have the pre-codes that are like 084 or 082, etc. And then you develop a list, and then there is software that you can use that can actually ping numbers to make sure they are actually valid numbers. So you can remove everything out of your database that is invalid, and then you can randomly select off of that list. But then the retaining of numbers, we work with a partner who has a large database of numbers that they've got that were shared with them from the mobile network operators. And then some of the numbers in that large database, they are sort of separated into what they call their active database. And those are people who have participated in surveys before. And what's quite nice about that active database is then you have some basic demographic information about them. So you can target specific people using that active database. It's not a panel that's managed like most panels are, but it is there is some demographic information that you can use in that.
Thanks, Shirley. And then there's a quick one from Marna Landman. Do you have a participant response rate for SMS surveys?
So it is quite low. It's a very good question. Response rates vary depending on the market and how established that active database is. They can vary from between about 10% to about 30% of people being invited responding, which sounds very low, but because you're using what's a quota sample anyway, it's a non-probability sampling approach anyway, so it actually doesn't matter that that the response rates are lower. When you're trying to replicate a probability sample, then of course that does matter quite severely. So if you're using random digit dialing and you wanted to do a pure random survey of the mobile universe, then your low response rate is going to be something that has to be taken into account in how you weight your data.
Yeah. Well, Shirley, a last one. I mean, there's just a source request which you can just answer in writing. But Jessica Roby had an interesting one. She said, how do you combine the SMS survey results and face-to-face survey results?
So it's as simple as it sounds. So ideally, in an ideal situation, you would want your surveys to be matched. So you want to have the same questions on both surveys. In the work that we did, we didn't actually have exactly that, but you essentially just extract the variables from your two databases that you want to combine, and you make them one. And then there is the challenge of load effects being problematic. So when you run the regression modeling to weight your data, you need to, in the model, select which mode you consider to be less biased. So that is a little bit of a judgment call, because what it's going to do in the model is then it's going to benchmark your results to being closer to that mode and how people respond in that particular mode. So that is a bit of a judgment call, and I think it depends quite a lot on the content of your survey. I would say typically, because we are used to using face-to-face surveys and where we're tracking data, where we've been working with data for a long time, what we've been using has been face-to-face in-person surveys. So we would typically select that as less biased. It might not necessarily actually be less biased, but because that's the benchmark we're going to be comparing to, that's what I would select as less biased. However, when you're doing something that's perhaps, say, on a sensitive topic, something that's a little bit more difficult for people to speak to. So, I mean, finances is actually a good example in some ways. People might not want to tell a person that comes into their house that, for example, that they didn't eat in the past. They didn't eat supper the night before. They've skipped 3 meals in the past 7 days. Whereas when they're doing that anonymously on a self-complete survey, they're more likely to give a more truthful answer. So in a case like that, you might actually want to, in your model, select your self-complete survey as the less biased.
Well, Shirley, let's wrap up there. I think there are 1 or 2 questions that you can respond to directly. And let's move on to the final data gathering method. So what do you do when you do need some face-to-face engagement? Now, Maftei and Sharon Njavika have been doing exactly this. Annie's with the Mastercard Foundation's Rural and Agricultural Finance Learning Lab. And she has extensive experience with nonprofit organizations and in the financial services space. And Sharon is a senior behavioral designer with Dalberg Design. So yes, they took innovation a step further in the COVID environment. Over to the 2 of you.
Great, thank you so much, Hennie. So wanted to start off just with a quick intro to who the Mastercard Foundation Rural and Agricultural Finance Learning Lab is. Sharon, if you could go to the next slide. Just for those of you who aren't familiar with our work. So the Learning Lab is a 7-year initiative of the Mastercard Foundation, and we are the dedicated learning partner of the Mastercard Foundation's Rural and Agricultural Finance portfolio. And one of our key activities is research, including a flagship report that comes out every about 18 months called the State of the Sector Report. And in November 2019, we published, in partnership with ISF Advisors, the 2019 Rural and Agricultural Finance Report called Pathways to Prosperity. And the report introduced new models for understanding rural clients and the provision of financial services to those clients. Next slide, please. So we won't have time today to kind of dig deep into some of the frameworks that we present, but I think just to provide some context to our presentation today, what we wanted to share with you is one of the big steps forward that we took in this new report that helps us reconceptualize the end clients for financial services. So in the past, our understanding of smallholder clients was limited to static data. What I mean by this is data around farm size, sort of what crops these farms produce, and then what they sell on the market. Whereas in reality, we know that rural households are dynamic, and as households pursue goals and face setbacks over the course of a lifetime or over the course of generations, their financial and non-financial needs evolve. And so what we did is we built on new research by CGAP, and we developed this pathway models that lays out different transition pathways that rural households and enterprises may take as they pursue various livelihood strategies. And so essentially this model moves us from a static understanding of households and enterprises based on their characteristics at a particular moment in time towards a more dynamic view of how households and enterprises might evolve over time and how those needs change as they move along the different pathways. Next slide. So after we launched this report, we started getting a lot of demand from various stakeholders in the industry to get a more granular view of who these households are within these pathways. And so we partnered with the Shell Foundation to conduct some additional research on 4 priority pathways in Kenya. And the reason why Shell Foundation was really interested in this is that they've recently launched a significant funding initiative that's aiming to accelerate access to energy for smallholder farmers. And they also wanted to understand how best to support rural communities and rural households to transition through different pathways and improve their livelihoods. So we developed this research, this piece of research to understand whether, how, and why rural households and enterprises transition through different pathways. And if they do transition, what are the financial and non-financial services that are crucial to accelerate or support those transitions? And so in our initial research, we were going to be using a combination of approaches. We were going to be using some human-centered design work, some primary data collection, and then we were also going to use and build on existing research and data sets in the industry, and also conduct some stakeholder interviews, and essentially try to build qualitative and quantitative profiles for the households and businesses that are in these 4 priority pathways. So our initial timeline was that we had our kickoff meeting on March 11th, but by the following week, various measures were starting to be put in place by organizations to protect staff. And then also the government of Kenya was starting to consider implementing some mobility restrictions. And by the end of the following week, it became clear that we weren't going to be able to conduct the human-centered design and the surveys that were both planned to be in person. So we had to make a decision. Were we going to pause the research and resume at a later date? Were we going to move to a fully remote approach, but keep the original scope as is? Or should we make some non-insignificant changes to both the scope and the methodology of the research? Next slide. So we realized that this pandemic actually represents a unique opportunity. It's a systemic crisis. And so, in fact, running and continuing the research in the middle of this crisis provided us with an opportunity to understand, firstly, if access to financial products and access to energy contribute to rural households and businesses' ability to withstand systemic shocks and avoid making backwards transitions. And secondly, which specific products and services are instrumental or crucial to helping those households and businesses build resilience. And so we decided that we wanted to adapt our research. And here there were 2 major considerations for us. The first was around how to think about the original structure and the timeline. So things are changing on the ground so quickly right now. So was our initial idea of having just a single phase of data collection an appropriate approach given the new circumstances? And so our decision was made to add a second phase of data collection to be able to sort of track changes in a sample population over time. The second major consideration was, what would the impact be of moving to a remote qualitative and quantitative data collection approach? And so we were worried here that because we're dealing with rural households, this might introduce a level of bias to our ability, and a level of bias by restricting ourselves to households that have access to phones and or have, a strong network. And we realized that this is also going to have implications on the type of HCD activities that could be done. And I think Shirley referred to this in her presentation. When we kind of looked at mobile phone penetration in Kenya, it is quite deep. the mobile gender gap in Kenya is around 5%. And so we felt confident that we could plan for this in our approach to the sampling and also in our approach to the implementation of the research. So it's still early days. We only launched this new approach to this research a couple of weeks ago, but we're able to share some emerging insights now on how that transition to remote HCD has worked so far. And I'm going to hand it over to Sharon to give you a bit more information on that.
Thank you, Anne. So for the rest of the presentation, I'll really just focus on our experiences with conducting that phase 1 baseline HCD research. And as Anne has mentioned, we will be going back later after the peak of the pandemic to really look at how some of these households really built their resilience strategies, what types, how they were affected by the pandemic, and how these mindsets that we found early on really panned out in the midst of an actual pandemic. So just to start off, I'll give an overview of what remote research and design is in the context of HCD. And here it's really similar to standard HCD in terms of the nature of our interviews, our questioning, and really how we prep, the tools and materials we use, as well as the technique that we use during interviews. The biggest difference really is the medium of interaction. So rather than physically going into people's communities and homes, we sort of connect with them remotely, either through audio or visual connections. We found that digital tools really enable, especially our internal teams, to partner more collaboratively. So we don't all necessarily have to be in the same location to go through the prep phase of the project. So that has been really useful as well as for capacity building with our teams on the ground. Fortunately, we've had some experience with remote HCD. So we are able to borrow some of the best practices from in-person research and translate them to more remote, to a more remote methodology. And I'll be sharing this a little bit later, which is really a remote HCD toolkit that can help other teams sort of go through design of research design, as well as workshop methodologies and facilitation skills to be able to go through whatever projects and phases that you're going through during the pandemic. We do cover all HCD methods as well. So it really covers the process from start to finish. I'll just go through some advantages and disadvantages that we had thought through before we decided to go for a fully remote approach. With a remote approach, it's really more flexible on time and locations and general coordination and convenience of teams. We are able to save on our budgetary costs around travel and just general logistical costs. One thing we found is that our sampling can actually be more widespread than it would be if we had to visit every single location. And we're also able to investigate change over time. So specifically for this research, taking a longitudinal approach, we're able to easily just reach the participants that we would interview in baseline and sort of just investigate any changes that happened over time. Another advantage is that it's generally environmentally friendly. So there's less carbon emission from less travel. And we're actually getting very creative about translating what would be traditional paper toolkits into more digital and remote toolkits. So that's a good thing. One thing that was really interesting is that there's a level of anonymity with remote research, or specifically audio research or phone interviews. This could likely be because the research power dynamics are a little bit reduced than when they would be in in-person research. And so there's a level of comfort and openness when people are speaking over the phone. And as mentioned before, it can also be more participatory, especially when capacity building with teams. teams that we normally work with on the ground, but are not able to travel. So we're just able to sort of share HCD practice in a remote way. Some disadvantages are around reach. So digital literacy really affects our sampling and our reach. So because of connectivity and just access to some of these digital tools, we're only able to reach a certain amount of people. So in this research particularly, we had started with Skype interviews, and we had a field staff on the ground who was moving around to different households with a computer, and we would set up the Skype session for the interviews. But what we found is, because the restrictions were getting tighter, he was not able to travel beyond the first few days. And so we had to get creative about how do you use what you have, which because there's such high mobile phone penetration, we just decided to go straight with phone interviews. One thing we found is that building rapport in many cases is best done face-to-face. So this team really needs to be very skilled and tactical to be able to do that when face-to-face interaction is not possible. This also applies to quality control and depth of the interviews. There's also very little room to improvise, pivot, and caveat as you would in person. So it really does take a little bit more time, especially if the interviewee is not as comfortable or as open. Consent takes longer. So we go through verbal consent and verbal dialogue to make sure that the participant is aware of everything that's being read to them throughout the interview. And one big thing about human-centered design is observation and media capture really adds to our reporting and our storytelling techniques. But taking a remote approach, especially in this case where we were using phone interviews, that media capture was really limited. And so we had to get a little bit more creative around working towards that. So just going through some of the tools that we used. On the left here are just standard HCD activities. So empathy, mapping, exercises, really going through life stage mapping. And this is just a series of questions to ask people about their experiences with work and life, their aspirations, and the strategies they've used to get to where they are. Asset mapping, just really looking at the types of assets they have, how they came to get them, and what they look forward to attaining in the future. Context setting, and I'll be talking through this in a little bit more detail, as well as scenario setting. And what we did is we translated any physical worksheets we would have on the ground in digital worksheets. And we used both Google Slides and Mural to be able to collaboratively work on them as a team remotely as the interviews were going on. So we would just add people to the calls that we were making. This would just be a direct line call rather than a Zoom call or a call that needed data. For video, we kept video interactions for the training sessions with the staff on the ground, which worked really well. So now I'll go through some of the remote research activities. One thing that we found to be really interesting was we understood that this is a crisis that's hitting everyone differently at the same time. And because there's so little foresight of how things are going to pan out over the next few months, with households, especially that have short-term foresight, so are not really able to see beyond the short term anyway financially, it's really difficult to get responses on how they would respond to any economic crisis that they would face as a result of COVID. And so what we did here is we brainstormed some scenarios based on some hypotheses we developed, also based on the understanding that we had over the pathways that Anne had mentioned before. And so we looked at different pathways, and this is one example of a scenario that we read out to the respondent during the interview, and we sort of asked them respond to it. So how would you respond to this scenario? What would you recommend? And what we hope to get is that their responses are sort of giving us a sense of what their attitudes and what their potential financial strategies may be prior to COVID sort of hitting them directly. And at the baseline, we'll go back and use these same scenarios to sort of probe and see if their attitudes or mindsets changed or shifted over time. And we'll also be able to assess how they've been affected by the pandemic. Right now, the research locations are in Makueni and some parts of Uasin Gishu. And what we found is that while people are not directly impacted by the health implications of the virus as yet, market access, movement, pricing has already started to take effect. So we're able to also see how that looks very early on. Internally as a team, we also employed remote research activities for the synthesis sessions. So this is an output of a mural board that we used for a daily synthesis session. And one thing that we also used in the interviews to build rapport with the teams was just set the context. And what this means is that because we're not able to visit and observe and really be in these people's homes and farms, we asked them to describe what their environment looked like as they were, from where they stood. And what we found here is, starting off the interview in that way, people take a lot of pride in talking about their homes and their achievements. And this exercise helped build rapport with them, but also put people at ease. It also helped us visualize some of the environmental context that people work and live in. And because the insights that we find from this HCD work will also inform the design of a survey, we're also able to collect some demographic information about household building materials, etc. That'll be useful a little later. So in summary, a review of the learnings we've had from our approach, we found that the insights have revealed more deeply the mindsets, attitudes, and coping mechanisms that people use to deal with COVID-19, because we are in a real-time shock, right? People are going through this in real time, and so we're able to collect this data. So really changing the methodology and caveating to make sure that we took a slight COVID angle to our research has helped us gain that knowledge. And because of that, we're able to design or inform better suited recommendations that are just a level deeper than what we would have done otherwise. In terms of the remote tools, specifically audio interviews, phone interviews, I guess those seemed like we were really foregoing a lot when it came to letting go of face-to-face interviews. But what we found is, for some people, this just really works better. As mentioned before, because the research and participant power dynamics are removed, and it potentially just improves people's comfort because they feel like they're more anonymized, and so they share quite honestly, to our surprise. And then the last thing is, really we're thinking differently about how to capture media using remote techniques, and really upping our game when it comes to participatory techniques when it comes to remote research, just to make sure that that human-centered design approach is not diluted. So just to show you, this is the link to our website where we have downloadable research and design primers, as well as the remote creative facilitation primers. So you can take a look at that if you'd like to know more about how to conduct remote research during this time.
Thanks, Sharon. To you and to Anne, I think what we've seen from these three sets of inputs is just how able we all are to adapt and innovate at a time when it's really necessary. And that some of these data collection methods have already been tried and tested over quite some time, and they're sort of hoping, certainly we're seeing that they're proving their mettle at this time. I'm just going to ask, before I ask Sarah to give us an indication of where you can access the webinar and the materials, just sort of a quick last question. And why don't we start actually, Anne, with you and Sharon. So in a sense, the current environment has forced you to adopt this sort of non-face-to-face approach to human-centered design research. Why do you think you'd continue something like this, even if there's a return to normality and you're able to do this face-to-face?
Yeah, great question. I think it's been highlighted by a couple of the panelists. There's some real benefits to this approach. I think certainly the cost effectiveness is a great benefit. The environmental impact, the reduction in the environmental impact from the travel involved is also, I think, a really big benefit. And the ability to deploy rapidly, and especially when it comes to human-centered design, for example, the ability to reach kind of a more diverse sample are all bonuses for us. I think, at least when I speak for the RAF Learning Lab, since most of our research really looks at rural populations, I think the biggest consideration for us going forward will always be around mobile penetration. And especially when it comes to the mobile gender gap, in countries where there's a big mobile gender gap, I think we'll always have to consider really carefully whether the benefits that I've just listed outweigh the potential bias that going fully remote introduces.
Thanks. And Sharon, do you want to add anything to that?
Yes, I think just adding to what Anna said, one thing we found is that the insights are not necessarily diluted. What we found to be important is just the quality of the interview technique, and just the fact that this also opens up an opportunity for us to train people and train ourselves on how to better do this remotely, I think is a plus, adding to the environmental impact and just the cost benefits that the remote approach offers.
Thanks, Sharon. Yeah, Shirley, what's interesting to me, obviously, is that at I2I, we started doing these SMS surveys or mixed methodology well before the pandemic. I mean, looking forward, do you think much of the future of surveys will be in this mixed method?
I think there's a lot of potential for mixed method, but I don't think it will ever fully replace the in-person surveys, or not in the foreseeable future, because I think the mixed method works very well for shorter surveys where you're looking at kind of indicators that you want to understand, or you want to do quite a rapid response type of thing like our COVID-19 survey. But something like a FinScope that has a lot of livelihoods understanding, and that in relation to financial services, I think it's very difficult to get that level of depth of information on a very short survey, and SMS particularly needs to be very short. I think telephonic interviews can be a bit longer, but still not quite enough to get that level of depth. That being said, we are also thinking about ways of trying to bring multiple surveys together. So having two surveys on different topics, but having kind of hook questions in both that you can use to actually kind of tie those two surveys together. But I think for the foreseeable future, well, for the immediate short term, I think we're very much going to be using telephonic interviewing for the next year or so. But I think once the pandemic is relieved, I think there's still a very big need for the type of depth that in-person surveys can give us. But I think there's a lot of opportunity to use mixed methods to get more data more frequently, and really close that information gap that we have.
Thanks, Shirley. I mean, let me slip in a question from Renata de Leers here, which I think is interesting. She wants to know which countries will be added to the COVID-19 tracker? Will there be countries in the Maghreb and French-speaking countries? And she wants your website available in French.
Wow, that's amazing. It's nice to hear that. We have done costing for some French markets, but we are still trying to source funding for it. So we definitely, if we can get the funding for it, would definitely expand the survey to anywhere that people want it, assuming we can get funding. Currently, we are not going to any French-speaking countries. We've got, coming up, we've got Rwanda, Uganda, Zambia, and Ghana. But if we can find the funding, we'd absolutely love to go everywhere.
Thanks, Shirley. Isabelle, transaction data as a data source into the future post the pandemic, your views?
Well, in some ways, transaction data is always virtual data because the analysis and the data collection doesn't require any face-to-face already. So it is a type of data collection that is very amenable to virtual situations. What is challenging, and I think is the face-to-face piece that is needed with institutions to build trust. And so in a post-pandemic world, that face-to-face aspect of building trust with either public or private institutions that you want to analyze the data with, that piece is still critical. And not having the ability to do that and starting with a new partner is very challenging. And I think to be able to build that relationship and to build trust, to be able to overcome the hurdles that are required within bureaucracies and to ensure privacy and data security and good governance, much of that piece is a human element that is brought in by prioritization that comes from trust and really believing the value that this can bring. The technical pieces and the analysis are virtual anyway. But I think that there will always be the need to have a face-to-face aspect for the trust building to launch a project.
Thanks, Isabelle. Yes, one of the things that that the pandemic has reminded us in the age of digitization is that humans and human contact matter. That's very good to hear. Before I close, Sarah, where will people and attendees be able to find the materials and the webinar after this?
Thanks, Hennie. Yes, this webinar today was recorded so that we can share it afterwards on the Cenfri YouTube channel. I'll post a link to that channel in the chat, so please feel free to access it there in the coming days when we've uploaded it.
Great. Well, thank you to all of you for attending. A special thanks to Isabelle, to Shirley, to Sharon, and to Anne for contributing your experiences. It was very insightful. And from our side, as Insight to Impact and Open Eye to Eye, we continue learning, and you must please continue innovating because otherwise we wouldn't have good learnings to share. Have a great day or evening wherever you are. Goodbye for now.